Hi, my name is Tamika Wright. I am in my adult health 2 discussing some of the disorders for the gastrointestinal system. The one that I would like to discuss today would be on gastritis. Gastritis is an inflammation of the gastric mucosa. I apologize. So it's the inflammation of the gastric mucosa. Gastritis could come up as chronic or acute. May be diffused or localized. So let's go into some of the pathophysiology. When the breakdown of the gastric mucosa allows hydrochloric acid and pepsin to simulate or diffuse back into the gastric mucosa, this can cause edema in the stomach tissues. This then results in an infiltrated abruption into the capillary walls, which can cause a loss of the plasma within the gastric lumen. It's also a possibility for hemorrhage. Some of the testing. So how do we determine this? How do we know, or what are some of the things that will let us know, hey, this is a concern? The diagnostic testing that we would use, or the one that is primarily determined, would be known as the EGD, or the endoscopic examination with biopsy. This is what is commonly used when obtaining a definitive medical diagnosis. Some of the causes of gastritis is going to be a overuse of NSAID, smoking, an excessive use of alcohol intake, H. pylori. That's one of the big ones. Stress is actually a contributing factor as well. And in regards to the H. pylori, it can actually result in peptic ulcer disease. So we definitely want to know those causations, because then we have to do tests for those things as well. So going back into the diagnostic testing, we're going to want to do a breath urea, or a test for the breath urea, which will let us know, hey, this has got H. pylori. So those are definitely what we would like to know. We would also want to know, let's do a a fecal occult blood test. That's going to let us know if there's blood in the stools of the patient. We would do an upper GI stress series. And these are some of the diagnostics testings that we would utilize to determine whether or not the patient has gastritis. How's this going to show up for us? Clinical manifestations of the disease. Well, the clinical manifestations for acute, let's start with the acute part first. For acute gastritis, you may see things like a patient or individual may be anorexic. Nausea is common, epigastric tenderness, vomiting. And the person may always feel like they're full, always feel full. Acute gastritis is also typically resolved anywhere from a few hours to a few days. So it's actually self-limiting. Okay, you may also notice things like dyspepsia, which is another word for heartburn. You're going to see them with a lack of appetite. And so these things can also form ulcers, which is a bleed, which can lead into anemia. Okay. So for chronic gastritis, they're going to carry some of the similar and same symptoms as acute gastritis. However, some of these individuals definitely may be asymptomatic. So we may not have symptoms. There's also going to be another significant difference from the acute to the chronic, which could result with the lack of cobalamin due to the injured atrophic parietal cells in our mucosa, which causes the individual to develop pernicious anemia. Okay. All right, so let's go into interprofessional care that should be provided. How are we taking care of this patient? The individual should focus on eliminating the foundational cause and prevention of reoccurrence. So we don't want this to reoccur, but we got to get to the cause of this. Why did this happen? If a patient is presenting with vomiting, we want to make sure the patient is resting. We do not want the patient to be eating, so they should definitely be NPO. And we want them to get hydrated, so we're definitely going to do that with hydration fluids. Antiemetics will be provided to relieve some of the nausea and vomiting. Depending on if some of the cases become more severe, we're going to need an NG tube. May use also to monitor for for bleeding. So what else are we going to be doing? Once Excuse me, I'm sorry. Hold on. Dehydration. We're going to monitor due to vomiting can happen really quickly. So patients typically are dehydrated. What is our treatment plans and medications used for this patient? Antibiotics. If H. pylori is present, we definitely want to get them antibiotics, and we want to make sure that they complete that use of it. Once the nausea and vomiting has resolved, we want to get them on clear liquids and slowly get them back into solid foods. Bland though, they have to be bland foods. Histamines, H2 receptor blockers, along with PPI or protein pump inhibitors will likely be the pharmacologic therapy provided for this patient. Chronic gastritis treatment will be specifically targeted to evaluate an elimination of the cause. The patient will be encouraged to do a lifestyle adaptation. So we need them to change, reduce some of the stress, implement therapies such as smoking cessations, and minimize alcohol intake. We want to definitely educate the patient on this. So how do we deal with this? So as a nurse, we want to assess the patient's social history. That's how we're going to find out, hey, do they got a smoking cessation? How many packs are they smoking? And alcohol intake, the NSAID use, corticosteroid intake. We want to monitor the patient's input and output for electrolyte fluid imbalance, along with the need to keep the patient hydrated. If the patient is vomiting, keep the patient on NPO to prevent aspiration and choking. Monitor the patient's daily weight, same time, same scale. Every day to check for signs of anorexic or significant weight loss. We also want to confirm if the patient has a history of any GI disorder, specifically history of H. pylori, to inquire of reoccurrence. We definitely want to educate the patient on the use of NSAID and risk factors such as the smoking and binging on alcohol or excessive consumption of alcohol use. Encourage the patient to reduce the level of stress within their lives. Encourage methods to implement and monitor smoking cessations. We definitely want to give the patient all the resources to follow through on the lifestyle change and let them know what can happen if this doesn't get resolved. We definitely don't want them to develop peptic ulcer disorder. Well, that was my take on the gastrointestinal disorder. Mine was gastritis, acute and chronic. So thank you for taking your time to listen, and have a great day.